and we are covering the skeletal system. So let's go ahead and begin. Now, I already recorded several videos on that cover skeleton. So in this video lecture, I will go pretty quick over the material without going into details, landmarks, and different features of the bones. So it's going to be pretty much overview. If you want to watch specific videos that cover different bones of your body and their landmarks, I have another videos and I will leave the link to that videos in the description section. Okay, so we're going to start with axial skeleton. Now your skeleton is divided into axial and appendicular. Axial skeleton consists of 80 bones and made of 3 major regions: skull, vertebral column, and thoracic cage. On the diagram over here, you see axial skeleton colored in blue. On the diagram over here, you also can see axial skeleton, the skull, thoracic cage, and a vertebral column. And everything shown here in yellow is part of appendicular skeleton that we will cover later in this chapter. Now, if you look at the skull, it's made of bones of cranium, neurocranium, and bones of face, of facial bones, viscera cranium. You see those lines that connect bones of the cranium, the neurocranium, and viscera cranium? Those lines are actually joints. They're called sutures. Sutures are immobile joints. That means there is no movement between the bones that connected through sutures. Sutures are made of dense, fibrous connective tissue, and they add strength to the structures. The major sutures of the skull include frontal, squamous, lomboidal, and sagittal. Next couple slides show you views of the skull from different angles. So, for example, here you see anterior view and bones are colored into different colors. So again, in this lecture, I cannot go over every single PowerPoint because otherwise it's gonna be like 5-hour video lecture, and I know nobody wanna watch it that long. That's why I have several shorter videos where I go over different parts of the skeleton in more detail. On the picture below, you can see the skull from the posterior view. So anterior view and posterior view here. On the next one, you will see lateral view, inferior view with mandible removed, and mid-sagittal section that showing internal anatomy of the left half of skull. If you look at the cranium, you will see lots of openings right over here. And this is called a foramina. So we have a different foramina within the skull that their purpose is to allow passages of the nerves and blood vessels. So I'm just gonna look at one example. For example, carotid canal, right? So we have carotid canal. It's for internal carotid artery, right? Foramen magnum, you will find vertebral arteries, medulla of the brain, spinal roots of accessory nerve, nerve number 11, and so on. Now we're going to cover bones of the skull without going into many details. Okay, neurocranium. Neurocranium make a cranial cavity. Inferior part of the cavity is occupied by brain. Calvaria is the skull cap. So we have cranial cavity shown over here. So that's inferior part of the skull. And we have calvaria, that is the cap. Within cranial cavity, you will find several fossa, anterior fossa, middle fossa, and posterior fossa, and different parts of the brain are located in those fosses. Anterior fossa, you will find frontal lobe of the brain. Middle cranial fossa, you will find temporal lobe of the brain. And in posterior, there is a part of the brain that's called cerebellum. Neurocranium is made of 8 bones. Superior and anterior part is frontal bone. Inferior part is occipital bone. In occipital bone, you have a big opening over here that is called foramen magnum. And above the foramen magnum, you have brain, and below this foramen, you have spinal cord. On the lateral side, superior lateral side, we have 2 parietal bones, and inferior lateral side, 2 temporal bones. We have, by the way, let me go back. We have 1 frontal and 1 occipital. We have 2 parietal and 2 temporal bones. A sphenoid bone, shown here in green color. So this is the calvaria, and you're looking from above, right? So the cranial cap was removed, and you're looking on inferior part of the skull, looking from above, and this bone right in the middle, it's a regular bone. It's look like butterfly or a bat. This is sphenoid bone. This is inferior view of the skull with the mandible removed. You see this part, that is also part of the sphenoid bone. You have this area of the sphenoid bone where pituitary gland is located. It's called sella torsica. Ethmoid bone is also bone that is deep inside the skull. If you look from anterior view, you see ethmoid bone make part of the orbital plates, and also some structure inside the nasal cavity. If you look at mid-sagittal section, you can see this part that make that is inside the nasal cavity. This part is called superior nasal concha and middle nasal concha. This part over here on the top, it's also shown on another diagram over here. This is called crista galli. And you have a membrane covering a brain. It's called dura mater. And dura mater is attached to crista galli, and it protects brain. Okay, so let's kind of go back so we can review the 8 bones of neurocranium. So we have frontal and occipital. We have 2 parietal, 2 temporal bones, sphenoid and ethmoid. So right, so we should have 8. So 1, 2, 3, 4, 2 parietal, 3, 4, 5, 6, 7, and ethmoid is 8. Now, facial bones of the skull. The facial bones of the skull form the upper and lower jaws, nose, nasal cavity, and nasal septum, and the orbits. 14 bones with 6 paired bones and 2 unpaired bones. The paired bones are maxilla, that is your upper jaw, palatine bone, that is a part of your hard palate. If you put your tongue up, if you move your tongue up, you will touch the hard palate. Palatine bone is a part of your palate. Zygomatic bones, nasal bones, lacrimal bones, and inferior nasal conchae bones. The unpaired bones are vomer, and vomer is a part of nasal septum, and mandible bone, that is your lower jaw. Also classified as the brain case bones, the ethmoid bone also contribute to the nasal septum and the wall of the nasal cavity and orbits. So ethmoid bones that we just covered previously is not part of a facial bones. However, it does contribute into some structures of the face. Okay, so here we can see nasal bones right there, making a bridge of the nose, and a lacrimal bone right here. It's a medial plate of the bony orbit, and lacrimal means tears. Zygomatic bones, or your cheekbones, right here is a lateral view. Vomer, remember vomer is a part of nasal septum. So here's the vomer bone in the mid-sagittal section, and in anterior view. So here's the nasal septum that divides your nose into right and left nasal cavities. Now this upper part of the nasal septum, this is ethmoid bone. And this structure on the lateral wall of the nasal cavity, those are ethmoid bone. But inferior part of the nasal septum is vomer. It's unpaired bone. Inferior nasal concha, shown right here. So we're looking again at mid-sagittal cross. This part here, this is ethmoid bone, crista galli, superior nasal concha, middle nasal concha. Those 3 parts are part of the ethmoid bone. That is not facial bone, it's part of the skull. But this inferior structure on the lateral wall of the nasal cavity, and you can also see it from anterior view, so it's here and here. Those are 2 small bones called inferior nasal conchae. Maxilla, shown over here, that's your upper jaw. And of course, it houses your upper teeth, but it also makes part of your cheek and even part of your nose, the bridge of the nose, and contributes into bony orbits. Plus, if you look on inferior view, so inferior view shown here, and mandible is removed. This part of the palate, hard palate, is still maxilla. So that's how your maxilla, and maxilla is 1, maxilli are 2. So that's 2 bones over here. And this is where they connected through the suture. But posterior, right here, to maxilla, it's also hard palate, but these two little bones are called palatine bones. So your hard palate is made of what it's called palatine processes of maxillae and two palatine bones. And mandible is the only movable bone of the skull. The rest of the bones are connected through sutures, and we already said sutures are immobile joints, but mandible form temporomandibular joint over here with your temporal bone, and this is a bone that moves because you need to chew your food. So this is how a mandible look like, pretty big bones that has a flat part that are flat, that has part that has a regular shape, and it houses your lower teeth. Now, this part is called, this is a process called condylar process, and this called carotenoid process of mandible. This is mandible angle. This is called a ramus. So here, this is ramus. Ramus is branch that we have condylar and carotenoid process, and this part is body of mandible. Okay, now we're gonna look at bony orbits because bony orbits are made of several bones. You can see it's made of frontal bone here, then zygomatic bones, maxilla, right? So that's a part of the maxilla. That's part of zygomatic bone, frontal bone. Shown here in yellow is sphenoid bone. Lacrimal bone is a green one. Ethmoid bone is this, like light orange color. So in the lateral view, you can see nicely that's nasal bone. Then we have maxilla, lacrimal bone, ethmoid bone, and yellow is sphenoid bone. And of course, superior part of orbit is made of frontal bone. And nasal septum, we already mentioned that nasal septum made of vomer. So here you see the vomer, that's inferior part. Superior part is a perpendicular plate of the ethmoid bone. And then you have a septal cartilage. So that's a cartilage of your nasal septum. And remember what your nasal septum does, it separates your nasal cavity into right and left cavities. Paranasal sinuses are air-filled spaces. They reduce bone mass, they resonance to voice, give resonance to voice. And if you look over here, they located kind of around your nose. That's why we call them paranasal. So it's around your nasal cavity. The biggest one are maxillary sinus in the maxilla, in the upper jaw. Maxillary, it's the largest, paired, commonly involved with infections. Then we have a frontal sinus in the frontal bone, ethmoid sinus, you can guess, in ethmoid bone, and sphenoid sinus in the sphenoid bone. Now, paranasal sinuses, as it says over here, it's spaces within bone. So you can only see them in X-ray. So if you have a bone, you will not be able to see the space inside. But in those sinuses, you will find mucous membrane. And the mucous membrane, if they drain mucus from those sinuses to your nasal cavity, and if this drainage is blocked, then you can have inflammation, you can have bacteria trapped and multiplying within the sinuses, and you have a sinus infection. Hyoid bone is not really part of the axial or appendicular skeleton. It's just kind of small bone found in your cervical region. So this is how it looks like. It has a greater horn, have a lesser horn, has a body of the bone. Hyoid bone is very important because it's a point of attachment for many, many muscles. So here's the hyoid bone, and we have the whole group of muscles above, and it's called suprahyoid group, and a group of muscles below, infrahyoid group of muscles. And many muscles that responsible for your tongue movement, for swallowing, connected to hyoid bone. Another part of axial skeleton is your vertebral column. It's made of 33 vertebrae, 24 are movable. So they have joint in between that allow slight movement in between vertebra, and the rest are sacrum and coccyx. They are fused in adults. Now, how do you name the vertebra? So when you in a cervical region, you name them with a letter C and number. So C1 is the first vertebra. It's a first cervical vertebra, and it articulates. That means it makes a joint with your skull. So we have 7 cervical vertebrae, C1 through C7. Then we're moving to thoracic region, and those vertebrae abbreviated with letter T, T1 through T12. So 12 thoracic vertebrae. Then you're moving to lumbar, and you have 5 lumbar, L1 through L5. So L1, L2, L3, L4, and L5. A sacral vertebra, we also have 5 of them, but they are fused, forming structure that is called sacrum. And coccyx, made of 4 coccygeal vertebrae, also fused. And the whole structure that is formed by those fused vertebrae is called coccyx. Now, your spine has a curvature. And curvature are named based on an area of the spine: cervical curvature, thoracic curvature, lumbar, and sacral. So 4 curvatures of the spine. So your spine is not just straight line. Those curvature increase the resilience and flexibility of the spine and ability to absorb shock. 2 posteriorly convex curvature, we call them primary, thoracic and sacral. So here's your thoracic. So posteriorly concave. That's going to be pelvic is another name for sacral. So sacral and thoracic. We call them primary because we are born with those curvature. And 2 posteriorly concave. So those are convex, and those are posteriorly concave, that are cervical and lumbar. They are secondary curvature because you develop them after the birth, when you burn, after you burn, right? So you develop cervical first. When babies start lifting the head, baby develops cervical curvature, secondary curvature. And when baby starts standing up and walking, he develops lumbar, secondary curvature. And again, curvature are important because they give you resilience, flexibility, absorption of shock. And if those curvature is not normal, It will affect the posture, how person walk, and can cause lots of pain. Because what is inside this vertebral cavity, that's your spinal cord, right? So if you have any not normal structure supporting your spinal cord, that might cause pain and discomfort. And here's, by the way, abnormal spine curvature. Scoliosis is abnormal lateral curvature when the spine, if you're looking at the posterior view over here, you see, well, actually spine should look straight, right? But here it's bended laterally. So here's the scoliosis. Kyphosis or kyphosis, most often it's kyphosis. Hunchback, so in this lady you can see kyphosis. Exaggerated thoracic curvature, and this is common in elderly females that are affected by osteoporosis. And lordosis is exaggerated lumbar curvature, and that can be a normal curvature in pregnant females, right? And after she gives birth to a baby, it will be back to normal. So it just might be a temporary, but if it's exaggerated to the degree when it starts affecting a patient life and comfort, then we can call it abnormal curvature. Now, structure of vertebra. You can see here that we have a body of vertebra. We have vertebral foramen. Inside you would find spinal cord, and we have several processes. There's a spinous process. It's a posterior part. So when you palpate, when you touch your vertebral column, you're palpating a spinous process. We have transverse processes, superior processes, and inferior processes cannot be seen over here. This is called, this part is called lamina, and this part is called pedicle. Now we have several different vertebrae. We already talked about it. We're going to start with cervical, 7 cervical vertebrae. C1 and C2 have a pretty different morphology or structure. You can see that C1 missing the body. So here's the body. Here's the body of vertebra, and every vertebra except of C1 will have a body. C1 does not. C2 has this structure on the top called dens. C1, there is another name for C1, atlas, and C2 is axis. And this is just pretty much typical cervical vertebra, C3 through C7. Gonna look similar to this one. It have bifid spinous process. So spinous process has 2 points, and you find extra foramina, extra hole called vertebral foramina. So you find it here, and you cannot see it in C2, but it is present in C2 as well. And all cervical vertebrae, you will have this vertebral foramina. And vertebral artery will move inside this foramina to the brain. Thoracic vertebra, T1 through T2. The spinous process will be pointing sharply down. It's pretty long spinous process pointing down. And you will find what it's called a transverse costal fossa. Costal fossa, this is where ribs are attached. So we have transverse and inferior and superior, inferior costal fossa, and transverse costal fossa only found in thoracic vertebra because ribs are attached to thoracic vertebra only. Lumbar we will have the very short spinous process and very massive bodies. So those are the biggest vertebra with massive bodies and with the short spinous processes. Okay, and we have sacrum. So here's the sacrum. All the structure that's called sacrum. It's made of 5 fused vertebrae, so you still see the spinous processes, foramina, that's posterior sacral foramina, anterior sacral foramina, transverse ridges, and this is where vertebra fuse. This is sacral canal over here, and this is coccyx made of 4 fused vertebrae. Now, sacrum and coccyx, as shown over here, make a part of pelvis. Now, if you look at a pelvis, this whole structure is called pelvis. The sacrum and coccyx are part of the pelvis, and they are part of axial skeleton. This bone is called hip bone or os coxa, part of appendicular skeleton. So pelvis pretty much is made of part of axial and part of appendicular skeleton. Vertebrae that make a vertebral column are supported by several different ligaments. So we have anterior and posterior longitudinal ligaments. So this is anterior view. So here's anterior longitudinal ligament, and here's posterior from neck to sacrum. So it's holds vertebra together. It's attached to the bodies of vertebra. Ligamentum flavum connects adjacent vertebra. So here you can see ligamentum flavum. And short ligaments. Short ligaments have different names, but they connect each vertebra to those above and below. Like this one, supraspinous ligament, I'm sorry, or interspinous ligament, intertransverse ligament. So they all commonly called short ligaments. Between the vertebra, you will find structure that is called intervertebral disc. Inter means between, so between vertebra. It's a cushion-like pad composed of 2 parts. Nucleus pulposus is inside its inner gelatinous nucleus that gives the disc its elasticity and compressibility. And annulus fibrosus is this part over here, outer collar composed of collagen and fibra cartilage. Thoracic cage, sternum, and ribs. So you can see on this diagram the sternum. That made of manubrium, body, and xiphoid process, and ribs. So here's different type of ribs that we have. So this one are true ribs, 7 pairs of true ribs. Then we have 3 pair of false ribs, and we have 2 pairs of floating ribs. So true ribs, false ribs, and floating ribs. So total is 12 pairs of ribs. Okay, so here we can see on the picture sternum again, and 2 ribs, and they show you how ribs are attached to the vertebra. They're actually attached to 1 vertebra on the top and 1 on the bottom, so it will be right in between, so attachment right in between two vertebral bodies, and it's attached also to the transverse processes, right? So that's why we have this superior costal facet, we have inferior costal facet, and we have transverse costal facets. So vertebra, this is head of vertebra attached to, I'm sorry, this is head of rib. So that's a rib. So that's a head of the rib attached to the body of vertebra and transverse process of a vertebra. And then it's attached to costal cartilage and cartilage attached to sternum. Sternum has three parts. Manubrium is this part here, body, and xiphoid process over here. In a young kid, this is still cartilage, and then it's ossified, became bone when we grow older. Ribs are curved, flattened bones, T1 through T12. So we have 12 pairs of ribs. True ribs is T1 through T7. First 7 ribs are true ribs. T8, T9, T10 are false ribs. And T11, T12 are floating ribs. Now, why do we have these names? Because if we move back over here, you can see that true ribs, they have 2 points of attachment, right? They attach to a vertebra, and then each rib has its own cartilage, costal cartilage, and it's attached to the sternum through its own cartilage, right? So here's the rib number 1 attached to vertebra, then curves, has cartilage, attaches to sternum. False ribs, rib 8, for example, it has attachment to vertebra. All ribs are attached to vertebra, but rib 8 has a cartilage that's not directly attached to the sternum. It's attached to the cartilage of rib 7, and through rib 7, it attaches to sternum. The same with 9. 9 has cartilage attached to cartilage of 8, 8 attached to 7, 7 attached to sternum. 10, rib 10, T10 has cartilage that attached to cartilage of rib 9, cartilage of rib 8, then cartilage of rib 7, then to the sternum. That's why we call them false ribs. Floating ribs have only one attachment to vertebra and no attachment to sternum at all. And this is where I'm gonna stop this lecture, because I will record the second part covering appendicular skeleton. So just want to remind you that here I cover axial part of the skeletal system. Thank you so much for watching, and I hope this video is helpful.